Okay, we are back with skill 2.33, administering topical medications. So topical medications can be anything that is, on the skin, right? Okay. Well, a typical one would be like nitro paste. Nitro paste is used for chest pain, primarily, and so that's what we're going to be using for this demonstration, is a nitro paste. Okay, so nitro paste is going to come one of two ways. Okay, it's going to come in a container like this. It's going to have a certain amount in that container. You may also see it in a big tube like this. Okay, and what you do is, well, first of all, you're going to check your medication orders. You're going to remove the appropriate medication. You're going to check it, make sure there's the expiration date, and when you take it out of the machine, you're going to look at the name, you're going to look at the date, you're going to look at the time that you need to give it. When you're preparing it, you're also going to check the label again, okay? And then you're going to be checking the label again when you're ready to put it on your patient, okay? So then you want to prepare the correct amount of medication without contaminating it. All right, so with nitro, you're going to be putting on a certain inches, okay? And we have what we call these papers, these nitro papers, okay? Here's a blank side, and if you turn it over, there's printed, and there's a half inch to an inch to a 1.5 inch to 2 inch, and you will put the amount of cream in between these two black lines, okay, for how much the physician ordered. Okay, he'll order a 1/2 inch nitro paste, or an inch of nitro paste, or 2 inches of nitro paste. Generally, in a package like this, it'll be 2 inches in there, okay, generally. So how do you prepare the medication? Well, first of all, with any type of patch or paper or whatever that we're putting on, or dressing, right? A dressing that we're putting on our patient, what do we have to do? That's right, we have to put our initials, our date, and our time of when we did that dressing change. Well, you have to do the same thing with a medication when you're putting it on somebody. So on the blank side of the paper, okay, the blank side of the paper, you're going to put your initials, the date, and the time. If you can see, I've already done that, okay? You want to do that before you put the medicine on the other side, because when you go to put this on the patient and there's medicine on there, you don't want to be trying to write on that, okay? So it's best to write your initials, date, and time on the back, on the blank side of the paper, before you put the medicine on, okay? So our physician's order is to put 2 inches of nitro paste on our patient, okay? So what we're going to do is we are going to just take our paper, and we're going to take the medicine, and we're going to just go along that line and put 2 inches worth of medicine, okay? You see that? I've just put 2 inches of medicine. All right, we put our cover back on our medicine. All right, now this needs to go against the patient, and what you do is you're going to find a area of skin that's not irritated, broken open, or whatever. Chest wall, upper arm, okay, work best for nitro paste. And you're just going to place it onto the skin, okay? And when you place it on the skin, you want to rub it around just a little bit, not too much, but you want to get some of that medicine, around the area, okay? So now you're saying, oh, is that going to stick? It may not stick. So what you want to do is you want to have a piece of tape ready, okay? And you're going to have it on top. You're going to just tape that onto the skin. And I didn't get my piece of tape ready. Shame on me. Okay? So what we're going to do is we're going to just tape this onto our patient. Okay? Just like, oops, this. Just enough that that'll stick on there. It'll stay there, okay? We want it to stay in place. Okay. Now, if we were to be taking this off, okay, and having to put more medicine on our patient, so it's, you know, a few hours later, whatever the dosage hour it is that the physician wants it changed. You know, you may have an order that states to chest wall every 4 hours, okay? So now it's 4 hours later, and we have nitro here. Okay, it's already been put on our patient, and it's now 4 hours later, and we need to put more on, okay? What you want to do is you want to remove the nitro that you have, okay? So you want to remove it, and when you take this paper, okay, you want to fold it against each other, the two wet sides against each other, and that will go in the sharps container, okay? All right, so now if you can you see all that medicine there? We want to make sure that we clean that off, so we're going to wipe off excess, okay, wipe it off with a paper towel. Then we're going to take an alcohol pad and we're going to clean, okay? We're going to remove any of that old medicine there on that site, okay? So if we know that we just had nitro here, we want to alternate our sites every time that we put medicine on. So we'll go to another site on the chest wall or the upper arms to put the next dose, okay? When you're putting this, if you notice that it's broken or anything, of course you wouldn't use it. If you notice that maybe it's oily or they just had a bath and they put lotion on, you may have to take an alcohol pad and clean that area where you're going to be putting it, okay? So you may have to clean the area first, okay? And you would let that dry, okay? And then you would put the new nitro, spread it around, okay? And tape it into place. All right. So, nitro is a medication that you don't want to get on your skin yourself because it could cause you to have a headache for the rest of your shift, okay? When nitro is not utilized by the body, when you're not having chest pain and the body needs that nitro to help with that chest pain, it can cause us to have a headache, right? Because what does it do? Nitro vasodilates our blood vessels to get the blood pumping, to get that up to the heart, right? Well, if we vasodilate and we don't need that help with the heart, we're increasing the pressure within our vascular system, which can cause a headache, okay? So nitro is definitely a medication you want to put some gloves on, okay? So always remember that. You want to have some gloves on with that. So some topical medications may not be nitro. They may be just a salve to put on top of a broken area, right? Because that's a topical medication. It could be a topical medication. So he has, let's say they have a rash here and we need to put some topical medication. All right, gloves, right? Because there's a rash open, right? Yes. Okay. So we put the medication on and we lightly spread it onto the topical area, okay, of the rash. You may or may not cover that with a dressing, okay? It may be just leave it open, okay? So for that, you would have to know whether you need to put a dressing on. And it could be as simple as put some topical medication and put a Band-Aid on it. or put some topical medication and put a piece of gauze and tape it into place. So that'll all be written in the doctor's orders, okay? All right, so that is skill 2.33, administering topical medications.